And welcome back. In this week's House Call, we have Becky Paps from Gunderson, and we are talking about how genetics play a role in cancer. And I guess, can you kind of just start there? How do they play a role?
Yeah, so about 5 to 10% of all cancers are caused by a hereditary change in our DNA that can be passed from one generation to the next.
Really? Okay. And is there any sort of, I guess, is it all types of cancers?
So mainly, a lot of focus gets put on breast as there's a genetic risk. Colon also has an inherited risk, along with some uterine, some ovarians, some kidney cancers. So majority of cancers have some type of inherited risk depending on the genetic change that we can look for.
Okay, and so because it's in genetics, is there a certain time where we should maybe be screened for these cancers?
So the best time usually to be screened is at a cancer diagnosis. So a person who's been diagnosed with cancer is the best person to undergo genetic testing in a family, because we know that they have the cancer, so if there's something there driving that, we can go looking for that. But another way is maybe that person has passed on, or there's nobody else in the family with a current cancer diagnosis. But if a person has a family history where maybe there's 2 or 3 people in the family on the same side that has a cancer, that family history can really help guide us on what type of testing maybe should be offered to this family. Even a person who doesn't have cancer, we could offer testing. But there's always some caveats when that person doesn't have cancer.
Okay, that's all the time we have for. Thank you
right.
very much. We'll be right back with one more check of your forecast.